Doc Talk Live, a health show brought to you by Dallas Renal Group. Dallas Renal Group provides comprehensive kidney care, including transplant and home dialysis services. Information can be found on dallasrenalgroup.com or on Dallas Renal Group Facebook page. It is also sponsored by VCare Home Health, a leader in providing home health care services throughout the entire DFW Metroplex. My name is Dr. Kashif Chowdhury, and I'll be co-hosting today's show with Dr. Vic Prakash. You can watch us live on our Facebook page, and after the show, head on to our YouTube channel, Doc Talk Live, and like, comment, and subscribe to see the great shows we have scheduled in the upcoming weeks. More details can also be found on our website, Doc Talk Live. If you are a healthcare professional and would like to be on the show, please send us a request through our website or through our Doc Talk Live Facebook page.
This is Dr. Vic Prakash, your co-host of Doc Talk Live. Today, ladies and gentlemen, we have a great show for you, and it is discussing pain management. Joining us will be Dr. Abdul Hayee and Dr. Irfan Ali. Pain affects more Americans than diabetes, heart disease, and cancer combined. Almost 80% of U.S. adults will at some point experience back pain in their lives. It's a significant public health problem that can cost society up to $560 billion annually, according to the 2012 National Health Interview Survey. The long-term effects of chronic pain include disability, loss of wages, productivity, and psychological distress. So to be part of our conversation today, call our studio 972-235-5555. Again, that number is 972-235-5555. We'll be happy to take your questions live throughout the show. Dr. Hayee and Dr. Ali, welcome to Doc Talk Live. Thank you so much for volunteering your time to be a part of the show. Tell our listeners a little bit about yourselves, your services, and your office locations. Dr. Hayee?
Thank you very much, Vic and Kashif. Thank you for allowing us to come on your show. It's an honor and privilege to be here. Thank you, everyone, extending our greetings to your listening audience. My name is Dr. Abdul Hayee. I'm one of the founders of Flower Mound Pain and Spine Physicians. We started seeing patients in 2009 to treat comprehensive interventional pain, and with the blessings of God, we've been able to expand to 5 locations across the DFW Metroplex to now include South Lake, Flower Mound, as I mentioned, Frisco, McKinney, as well as our Dallas location, which is actually in Richardson. Myself and Dr. John Vu, my initial partner, when we started, we wanted to treat pain patients, and that was our main goal, to bring everyone who had pain, diagnose them, and offer them interventional services to the best of our ability. We've been able to add on 5 associates, 2 nurse practitioners, and are providing care on a full-time basis at those locations. So Dr. Ali is here with me. I'll let him introduce himself as well.
Hey, Vic and Kashif, thank you very much for having us, and all the listeners, thanks for joining us. I'm very lucky to be here and very privileged to join this group recently. And like Dr. Hayee said, that we do have 5 locations, and we cover mostly Dallas Metroplex area, and we treat pain in multimodal approach with all different aspects, whether it's chronic pain, cancer pain, spine, and take care of them in the best possible way.
I'm sorry to interrupt. I failed to mention that your listeners can contact us at 972-350-0225 or online at www.flowermoundpain.com or southlakepain.com.
Thanks again for being on the show. My first question is to you, Dr. Hayee. At what pain scale should a person see a pain management specialist? What kind of pain needs immediate attention?
So this is a very important consideration due to the fact that pain is actually a normal part of life. Pain tells us when we've injured ourselves and when we basically need to take a break from whatever activity it was that caused that pain. And so it requires the patient or the person to be aware or self-aware of their body and know how long it takes to heal from whatever activity is that is causing them. So a normal response to injury, you have an inflammatory phase, takes about 2 days. And then after that, you've got a regenerative phase, which takes from that 2 days to about 6 weeks. And then after that is rehabilitation. And rehabilitation in certain injuries can take up to a year. But most of the time, if I'm playing basketball and I twist my ankle, or if I'm on a flight overseas and I get out and I have back pain, that's pretty much to be expected. What's abnormal is if it doesn't heal during the normal time frame where I've usually healed. And that's really should be the cue for the listener or the patient to say, okay, this is not normal. I need to come and see advice. Initially, when it happens, the pain is telling you, okay, take a break. let your body heal. But if it continues, or after repeated instances, you played basketball or you've gone on those flights, and now you're finding your injury is not healing as fast as it should, that's really when you need to seek care. Whether you go see your primary care doctor, whether you go see a therapist to get therapy, and then eventually, if it persists besides those initial interventions, you should see a pain specialist like us.
Folks, you're listening to Doc Talk Live. We're live in studio with Dr. Hayee and Dr. Ali, who are pain specialists, and we're discussing acute and chronic pain today. Dr. Ali, one of the most common causes of job-related disabilities, especially in the IT section of workforce, is low back pain. Can you tell us some of the causes of back pain?
Yeah, so just to elaborate on what Dr. Hayee was saying, that most commonly, in most of the young folks, whether it's work-related or something like that, the most common is, most common injury is work-related, some muscle strain, something like that. And most of those things will get better with some rest, therapy, heat, ice, non-steroidal anti-inflammatory drugs. But if it goes on for a while, the other common reasons which are worrisome is like if there's a disc herniated, if there are any red flags, meaning any weakness of the legs or anything like that, that's when you definitely should try to seek immediate medical attention and don't wait. But most of these things, if it's just medical strain or something like that, should get better within 4 to 6 weeks. Anything goes longer beyond that or have red flags, then definitely should seek medical attention right away.
Okay, we have a live caller. Let's take a live call. Go ahead, you're live on the show. Dr. Ali, what are your thoughts on that?
Yeah, so this is a kind of very common scenario which we see day to day in our practice. The common analogy which I use for most of my patients for chronic pain is that what happens, like the initial inciting injury or factor is resolved. Whatever was the initial injury is gone. Like the fire has been put off, but the alarm keeps going on, and that's what chronic pain is. That whatever was the inciting injury, that's done. But now you have to do something about that alarm which keeps going on. And sometime in order to get that alarm settled down, you have to use a multimodal approach. And I understand a lot of patients are stuck in this situation. They go from one provider to another provider, and they get these split messages. And sometimes, these kind of patients would definitely get help coming to a intervention pain specialist who can try to gather all these people together on one page and try to come up with a multimodal approach which is customized for that patient. So this is the kind of patient I would say that should seek medical attention with the intervention pain specialist. We have definitely different locations in all parts of Dallas Metroplex. One of us would be more than glad to see them and try to come up with a customized plan and try to bring everyone on the team together to see what we can do.
Yes, again, we're located in Flower Mound, South Lake, McKinney, Frisco, and Dallas. So this is Dr. Hayee. Just to follow up on what Dr. Ali said, it would basically start with us talking to your wife or any patient and seeing where her pain is coming from, the pattern of her pain, what she's tried before, whether she's been to a chiropractor or she's been to an orthopedic surgeon, whether she's tried injection therapy, what types of physical therapy, what types of stretching, and then really trying to key in on not only her pain but also the functional loss, or what she could do before and what she can't do now, and figuring out how all that relates together, and then looking at any images that she's had done, any x-rays or MRIs, and then finally doing a physical exam. And then once we have all those clues together, we can then propose a plan. It may require different medications, it may require further physical therapy or even chiropractic care, and it may require some of the procedures that we do in our office. But putting that all together, we hope to tailor-make a plan to get patients back to their life.
That was helpful. Let's take another call. Go ahead with your question. You're live on the show. Dr. Hayee, what's your input on that one?
Sure, this is a very common phenomenon. Well, I shouldn't say common, but it is prevalent. Most surgeries heal well, but unfortunately there are a certain subset of individuals that continue to have pain, and that's just the way our body is designed. There's nerve tissues around the areas where the surgery takes place, and a lot of times the nerve can be involved in the surgery, or as we heal, a scar will form, and that will entrap or contain the nerve. And that causes a persistent irritation on the nerve, or certainly if the nerve is damaged, it can continue to transmit pain. And again, we would start off by treating that pain in multiple different ways. The first step, as Dr. Ali mentioned earlier, is just conservative therapy with anti-inflammatories, maybe a topical solution that we can rub if a nerve is close to the skin, like it is when we're talking about inguinal hernia repairs. If pain continues after that, there are certain nerve blocks that we can do that will actually turn that nerve off. It has been shown that if you're able to interrupt that pain stimulation from that area, we can actually decrease the pain firing so that patients can have less pain perception to that area. And then finally, there's some advanced procedures that we can do where we actually either block or scramble the nerve signal coming into the spine so that the patients don't feel that pain anymore. We'd love to discuss that with you in our clinic if you'd like.
Just to add on to that, this is Dr. Ali, just like Dr. Hayee said, and in some of these cases when everything you have tried is not working, then potentially there are options for more advanced therapy like peripheral nerve stimulator, where there's a little lead which you put on top of the nerve, and that can take care of that nerve entrapment as well. So there are options available for sure.
Dr. Hayee, as per some estimates, the U.S. spent close to $100 billion a year on low back pain. What are your thoughts on it, and does this pain go away completely?
So obviously, as Vic mentioned earlier, pain is a very significant part of the pathology or diseases that we see in this country. And as such, with that, certainly is the treatment. Now, part of that treatment numbers that you quoted are due to the rising costs of medications. And we've seen that as medications continue to be developed, the cost of that is then passed on to the patient. And certainly, we want patients to avail themselves of the medications that are there, but also the treatments that are available for them to help decrease their pain. And it starts really by using the intervention that will provide them the most relief and is the most effective. A lot of times patients are utilizing treatments that may not be the best for them, won't give them, quote unquote, the best bang for their buck. And so that's where we come in. We're the specialists in diagnosing pain and tailoring their pain treatment so that they can get treatment as quick as possible.
All right, folks, you're listening to Doc Talk Live. We're live in studio with pain specialists Dr. Hayee and Dr. Ali. We're about to head into a 5-minute commercial break, but please keep calling during the break. We'll take your questions down and we'll answer them as soon as we come back.